Hi, I'm Dr. Chris Hughes. Welcome back to Dental Implants 101. The next topic I'd like to discuss is, am I a candidate for dental implants? What is the procedure like and what is the recovery like? Is there going to be pain? What can I expect from dental implants? So first of all, we'll talk about, are you a candidate? And the first question that comes up, because frequently dental implants are done in a population that is probably around 40 years or older, is, am I too old for dental implants? Really, the question is, are you too old to enjoy your food? Are you too old to look good? Are you too old to feel good? Are you too old to feel whole and healthy? The basic answer to am I too old is, there is no age limit to dental implants. As long as a person is reasonably healthy, can walk into our office, doesn't have a myriad of life-threatening medical conditions, I would say that they're going to be a candidate for dental implants. Now, of course, there are some considerations to that. There are some people that we're going to have to be more concerned about. Number one are smokers. People who smoke, and especially smoke heavily, are going to pose a problem for dental implants because they're going to be more prone to infections and complications after implant surgery. Another major problem can be diabetics if they're not controlled. And that's a very key point, is if they're not controlled. If you are a diabetic and you're able to keep your hemoglobin A1C values around 7, you should be fine. However, if you are not and you're out of control with your diabetes, then you're going to need to see your physician first, because as you diabetics know, healing can be a problem if your blood sugars aren't under control. So certainly, if you're well controlled, you're a 7 or below with hemoglobin A1C, shouldn't have any problems. What about bleeding? What if I'm on anticoagulants like Coumadin, Plavix, so forth? Am I a candidate? Do I need to take that? Again, generally, these are problems that we can handle. In most cases, you don't have to go off your anticoagulant medication. However, that is something that I would determine with your physician, and it would have to do, that determination would be made according to what your personal needs are and what the needs are of the surgery. The next question that you may wonder about is, well, how do you actually do a dental implant and what is it like? So first of all, if it's a relatively simple procedure, if we're just putting in 1 or maybe 2 implants, frequently we can do that just with local anesthetic. That's what we use to get your jaw numb or your teeth numb. And as far as having the implant put in, I typically tell people if they've had a tooth removed, it's certainly no worse than having a dental implant put in. And in most cases, it's actually easier. Basically what we do is we make a small incision or take a small cookie cutter round portion plug out of the gum, make an opening into the bone where the implant is going to be placed. Then we just simply place the implant into the bone, and then we cover the gum on top of it, or sometimes we put a little healing cap on top of it. What that would be like is, if the tooth was missing, we make an incision, open this up, make a hole, put the implant in, and then we put sometimes a little top back on the implant, and then at a later time we put the tooth onto the implant. If we're going to do a procedure that's going to involve replacement of all the teeth, as we've talked about in the past, something like this, where we're placing a number of implants in the jaw, we may be removing teeth and placing implants and placing the teeth at the same time. In those cases, we use local anesthetic, but we also, in most of those cases, do IV sedation. So I do IV sedation here. I have a special permit to do that. I've been doing it for about 15 years in my practice. And what it does is it basically puts people to sleep. It puts them in a very relaxed, comfortable mode. It seems to allow the time to pass more quickly when they're very sleepy. And so we'll do the IV, we'll get them down and sleepy, and then we'll do local anesthetic, and then we'll do the procedure. Obviously, a procedure to replace a group of teeth is going to be more lengthy than replacing just one tooth. However, if a person wanted to be sedated for replacement of one or two teeth with dental implants, we're happy to do it. The last thing is the recovery. So after implant surgery's been done and the implants have been placed, what can we expect in terms of pain? There can be a wide response to pain. Generally, most pain can be handled by a combination of Tylenol and ibuprofen. That's what we typically use for pain management. In most cases, the simpler the case, of course, usually the easier it is, people are going to have some tenderness, some mild to moderate tenderness in the first few days, okay? In some cases, people will have more. It depends upon the length of the procedure and what was done. The more lengthier the procedure, the more tenderness generally we're going to see. But it is generally handled with a combination of, like I said, ibuprofen, Tylenol, and in some cases also Medrol, which is a steroid that we use for anti-inflammatory effect. And in some cases, if we have to, we could use a narcotic. However, those are usually rare. Usually all we have to use is ibuprofen and Tylenol. The recovery period can vary from really a single tooth going back to work the next day. In more complex cases, it can vary. If we're doing a whole dentition, sometimes we may want to wait another day or two for the recovery. Of course, we have instructions on how to recover properly. We have special rinses and so forth that we give the patients and ice packs to help expedite the recovery. That's some information on what a dental implant is like, are you a candidate, and the recovery period. Thank you.